I'm Molly Sullivan. I'm a physical therapist here at Aquacare Rehab in Millsboro, Delaware. And with me I have Jimmy Mundy, who is a student at UMES. Today we're going to go over part one of our two-part series. Part one is going to be finding a neutral pelvis and working through diaphragmatic breathing. This whole series is going to be working on core stabilization, which is really important for everybody, but in particularly anybody who's experiencing low back pain. So we're going to start off, we're lying on our backs. We're going to start off by finding a neutral pelvic position. So to start off with, we're going to give you a little cueing. So what you're going to do is you're going to take the heel of your hands and you're going to put the heel of your hands on the bony portion of your pelvis that sits out forward. Once you've done that, you're going to take the index fingers and you're going to put them onto your pubic symphysis, which is kind of that bony prominence as you walk down towards your pelvic region. With that, you kind of make a nice little triangle. When you're lying down, your triangle should be nice and flat. If you're standing, your triangle should be nice and vertical. So what we're going to do from here is we're going to start to move the pelvis, and I just want you to pay attention to how that triangle moves. So as you're lying here, you're going to take that low back and you're going to flatten it against the table. By doing that, what your triangle is going to do is it's going to tilt backwards as your pelvis tilts backwards. Good. Then you're going to pelvic tilt the opposite direction, so coming forward, the tip of your triangle should now be tilting down. This is the excursion of your pelvis. What we want to find is a nice neutral position of your pelvis. So rocking back, you're going to find a position where the pelvis is nice and flat, nice and parallel with the table, or if you're standing, your pelvis should be nice and perpendicular to the floor. Again, this is the position that we're starting in, and when we move on to part two of this presentation, you're going to notice that this is the position that we want your body to stay in. Once you've found this position, you're going to let your hands relax, and we're going to work through a little bit of diaphragmatic breathing. Diaphragmatic breathing is really important because the diaphragm helps to stabilize the top portion of your abdomen as you're going through core stabilization. Having the diaphragm work appropriately and be an appropriate length really helps to stabilize the abdominal contents. So to work on diaphragmatic breathing, we're going to put one hand on the abdomen, one hand on the chest, and all I want you to do is you close your eyes and pay attention to how you're breathing. What I want you to notice is which hand is moving first and which hand is moving most. So just take a minute or two, kind of pay attention to what your body does naturally. So breathing in, breathing out. Again, you want to pay attention to which hand is moving most, which hand is moving the furthest. Once you kind of figured out what your body is doing, the next thing we're going to do is kind of switch it to be diaphragmatic breathing. With diaphragmatic breathing, what we're going to do is that as you breathe in, the diaphragm will invert. It'll draw air down into your lungs. By doing that, your abdominal area will push out. So as you breathe in, the lower hand should rise up. As you breathe out, that lower hand should fall. With true diaphragmatic breathing, unless we're taking 100% of a full breath, the lower hand should be doing most of the movement. You should really be getting very little motion from your upper hand. So what I suggest with this is before you get into any core stabilization, that we're spending at least 2 to 3 minutes going through and breathing diaphragmatically. I'd say that I would deepen your breath just a little bit and spend some time here. If you're getting lightheaded or dizzy, go ahead and stop. But otherwise, work through that a little bit, just so that we're really making sure that the diaphragm is nice and active. All right, thank you, and look for part 2.